Good morning, everyone. Welcome to our first event for the California Budget and Policy Center's new speaker series, Empower, People, Policy, Progress. I'm Janice Yee, Director of Advancement for the Budget Center and moderator for today's conversation. Empower reflects the Budget Center's efforts to connect people and policies in order to create real progress. Our goal for this series is to empower all of you with the information you need to advance smart policy choices and public investments. Empower is also a free public education resource that is made possible because of viewers like you. So shout out to Patricia Schultz and Lori Fusserfield, as well as our sponsors for today's events, the Heising Simons Foundation, First 5 California, the Subsky Foundation, and First 5 LA. Now, due to time constraints, we will not be covering some of the new investments in job creation and workforce development or small business relief, nor will we be covering the justice system. But we wanted to note that the governor's budget does propose $1 billion related to COVID-19 prison relief funds and continues the plan to close 2 state prisons over the next couple of years. You can read about those budget items in our full report at calbudgetcenter.org. Also, due to time restraints, if you have any questions, please type them into the comments throughout the program and do not wait until Q&A, so that way we can consolidate some questions that come in and we can better order it in the program. All right, so let's get started. Today's discussion will focus on the essential question: does the Governor Newsom's proposed budget meet the needs of Californians? We will talk about where Californians are at now, a little bit about how we got here, and within the budget, what can we do to not only recover from the health pandemic and economic crisis, but how do we start investing in a more equitable California? It's an ambitious agenda, so to help us answer these questions today are my colleagues and experts in their fields, policy analyst Essie Hutchful, Kayla Kitson, Adriana Ramos-Yamamoto, and senior policy analyst Kristen Schumacher. Hi, ladies. So let's get started. Where Californians are at now. 2020 was a difficult year, but as we continue to see, just because it's 2021, it doesn't mean it's going to get any easier without deliberate and bold action. We must take purposeful steps to address the needs of our families, neighbors, and what all Californians are facing now. We must remember that 2020 was also not the start of all of our problems. Our systems throughout the nation and the state have been built on racist public policies that are embedded in most, if not all, parts of our society. This structural racism plays out in racial and gender wealth gaps, gaps in educational and economic opportunities, disproportionate representation in the criminal justice system, and most evidently, health inequalities. So let's start there. Adriana, you have a report coming out in a few weeks that highlights how the COVID-19 virus has disproportionately affected people of color, but also how racism has played a part in that. Can you give us a little preview and share, where did we see these inequalities in health outcomes among Californians pre-pandemic? And how are we seeing these existing disparities been magnified during the pandemic?
Mm-hmm. Well, thank you, Janice, for starting the conversation on the topic of health and how COVID-19 has impacted health. As we approach almost a year into the pandemic, over 2.7 million Californians have tested positive for COVID-19, and over 31,000 have died due to the virus. And let's just take a moment to absorb this. Sometimes it's easy to take a look at these numbers, especially if you're seeing them all the time, and forget that these are people. These are family members, friends, members of our communities who are getting sick and are dying, and it's devastating. But Janice, you're right. As I'm sure our audience knows, the virus is disproportionately impacting communities of color. I'm going to show you all some charts that my colleague Monica Davalos and I have put together to highlight these racial health disparities. They're about a week old, but it'll still help us to understand the impact on communities of color. So this chart shows COVID-19 case rates by race ethnicity that are adjusted for age. As you can see, Native Hawaiian and other Pacific Islander Californians have the highest rate of COVID-19 infections, followed by Latinx Californians. And this next chart shows COVID-19 fatality rates by race ethnicity that are also adjusted for age. And just as you saw in the case rates, racial disparities are apparent in these death rates. You can see that Latinx, Native Hawaiian and other Pacific Islanders, and Black Californians experience the highest rates of death due to COVID-19. And these disparities are alarming, considering that some racial ethnic groups are generally younger than the other demographic groups. So we really shouldn't be seeing them dying at such high rates. And age is important to take into consideration because the risk for severe illness and even death from COVID-19 increases as a person gets older. And there are a lot of different factors for why we're seeing this. We could spend the rest of the webinar unpacking this. But you said it already, Janice, it all really boils down to racism. Due to historic and ongoing structural racism that bars children, families, and individuals from equal access to healthcare, employment, housing, education, and other opportunities to thrive, communities of color have underlying health conditions that make them more vulnerable to health threats like COVID-19.
Yeah. It's really sobering when you take a step back from the numbers and really think about how many Californians this is really impacting, right? And part of that is due to the economic crisis that followed the pandemic. So we're not only seeing this around across racial disparities or groups in race groups, but we're seeing it across the economic classes. Californians with low and middle incomes find themselves having to make this impossible choice between taking care of themselves and their families' health and then going to work, and the economic security that brings to provide the basic needs like housing and food. So I want to move to Essie. Can you set the context for California? Where do we see the economic insecurity exacerbated, and who are those that are also most impacted?
Yeah, that's a really great question, Janice. So just sort of give us a sense of like what has happened to us in our state. It's important to note that the COVID-19 pandemic and the economic hit of that really targeted low-wage industries. So think about leisure and hospitality, sort of the restaurant workers. They really sort of felt the brunt of the job losses in our state, and we've lost sort of more jobs already than we had in the Great Recession, which sort of just give us a sense of scale. But okay, so who in those low wage industries? Who's in there? We know that almost 2/3, about 65.5% of those who were estimated to be most likely to either lose their jobs or lose hours of work due to this downturn are people of color. We know that women tend to be overrepresented in these industries, and we know that about a quarter of immigrant workers and a third of undocumented immigrant workers were in an industry that was highly hit by the COVID-19 pandemic. So that gives us sort of a sense of who really is feeling most of the pain here in the almost a year since we've been dealing with this. But then to sort of just kind of move back, that's where we are now, to give us a sense of where were we? Where were those folks when COVID hit us to begin with? And the truth is, we weren't really in a great place to begin with. So this hit low wage workers the most. We know that low wage earners, their earnings had stagnated really for decades, and you could look throughout the state, and you would have adults who are working full time, and they still aren't earning enough to meet the basic cost of living. If we're talking about primarily workers of color, primarily women workers being hit by this, we know that workers of color were earning less than their white peers, women workers earning less than their male peers. So across the board, any way you kind of look at this, precisely the same Californians who have been hit the most, the hardest, or the ones who were least served by the economy that we already had. So just to wrap this up, looking forward to where we might be, the administration is estimating that we won't really get those sort of jobs back, won't get back to where we were till about 2025. But it's important to note that that might not really be the goal that we want, getting back to a place of vulnerability for all these groups.
Yeah, thank you, Essie. To even think that far ahead, right, into 2025, and think that we're still not recovered, right, is particularly poignant, I think. I wanted to draw out a little bit more about these people that are being impacted the most, and how that's really tough on families. And you had mentioned specifically women, right? And I'm reminded of this quote that is, women are expected to work full time as if they don't have kids, and are expected to raise kids as if they don't work full time. And it reminds me, Kristen, can you highlight for us what it is that these resources for families, right, are needing during this pandemic? And how are we finding this balance between caring for and educating our kids and staying afloat? And where is that the most strain in that?
Let me unmute myself. Excuse me. Thanks, Janice. So like Essie mentioned, even prior to the pandemic, many Californians were really struggling to make ends meet. And a lot of my work here at the Budget Center focuses on how women, children, and families are faring. And we know in 2019, before the pandemic hit, roughly a quarter of Black children and Native American children were living in poverty, and 1/5 of Latinx children were living in poverty. And that's twice the rate of that for white children. And just for context, living in poverty means a single mom with 2 kids is trying to make ends meet on about $21,000 a year, which I think many of us recognize here in California isn't remotely tenable. Now, as he noted, so many Californians have lost their jobs or they've had their hours cut. They're struggling even more to pay for very basic expenses like food and rent. And again, this is especially the case for Californians of color because these disproportionate impacts just reflect these harsh, longstanding inequities stemming from structural racism, again, in education, employment, housing, and healthcare. This crisis is only exacerbating all of these inequities and this racism. So, Janice, to your question, what do Californians need to weather this crisis, particularly Californians with low incomes? And they need help paying for basic expenses. We want to make sure everyone has enough food to eat in our state. We also want to make sure that individuals and families don't lose their homes. The Federal Reserve in Philadelphia estimates that there is $1.7 billion in outstanding rent debt as a result of this pandemic and recession. And they also know that households of color hold a disproportionate share of this debt. Also, I think as many of us recognize, it's really hard to balance work and family responsibilities during this period. Our office is actually closed, but I'm here in the office because I have a first grader that is engaging in distance learning at home. And I also have a 4-year-old. And because I was able to transition seamlessly to teleworking from home, thanks to the Budget Center for that, I was able to actually find new childcare for my 4-year-old when his center closed. And I was also able to help my 7-year-old with distance learning. But we know that this isn't the case for many working parents, particularly for many essential workers, and particularly for many workers with low wages. So families in California need adequate paid time off and access to affordable childcare. And unfortunately, both of these are often out of reach for so many families in our state.
I feel you there. And I think like taking a step back, the reality is that millions of Californians are still suffering, and especially those that already had low and middle incomes and people of color. And we need our state leaders to do more, to be bold, because while California was arguably in a good financial situation pre-pandemic, we must be realistic on what is needed now and what is needed for years to come. And how are we going to do that? Over the last few years, the state had really been able to build up reserves under the Biden administration. And last year, state leaders were able to tap into those reserves. But they're just that, emergency funds, right? And not intended to be sustainable sources of revenue. So Kayla, can you remind us a bit about how the state used some of those reserves last year?
Yeah, sure. So prior to the onset of the COVID crisis, as you mentioned, the state had been doing fairly well and had been able to build up over $16 billion in budget reserves in its rainy day fund, which is officially known as the Budget Stabilization Account. So this account provides a cushion for the state in case of a sudden downturn, but it can funds can only be withdrawn if the governor declares a budget emergency, and even then, not all the funds can be drawn down at once. So last year, in anticipation of a hit to revenues and increase in spending to address the COVID crisis, the governor did declare a budget emergency, and the budget that was enacted in June of last year did include a $7.8 billion drawdown from the rainy day fund. It's also important to note that the series of federal COVID relief packages that were passed throughout last year provided another cushion for the state budget, in that it provided direct assistance to families and businesses, schools, as well as the state and local governments. But there are gaps in that federal relief, and we don't know that future relief is guaranteed. So the state really does need to do more to provide both immediate relief and to make ongoing investments in an equitable recovery.
Very good point. I want to re-emphasize that. The federal relief is not guaranteed. It's also, as we can see, we don't know when it's coming, how it's going to be distributed, et cetera. And so the latest federal relief package, the one that happened in December, happened after, I think, the governor was able to account that for his proposed budget, right? And that actually did supply critical relief for states. Can you give us a little bit of brief overview of what that package did for Californians?
Sure. So the most recent package, there's a lot in it, but I'll try to cover the basics. Some of the most important things for Californians to know are that there's a second round of direct payments to individuals and families of $600 per person. Notably, mixed status families are eligible for payments this time, while they were excluded from the first round of payments. But unfortunately, the new round of payments still does exclude people who pay their taxes with individual taxpayer identification numbers, or ITINs. So that's mostly undocumented workers. The package also included an extension of the expanded unemployment benefits that were put into place last year. There's also rental assistance, which is critical. There's a brief extension of the federal eviction moratorium. And also importantly, there's an increase in food assistance. So in California, that's the CalFresh program. And finally, there's some assistance for childcare providers, schools, and colleges, as well as funds for the state and local public health response. But that said, there are some gaps in the package. There is, again, no aid for states or for local or tribal governments to help cover future revenue shortfalls. There's also no extension of the requirement that employers provide paid sick and family leave for workers that have been affected by COVID or that have caregiving responsibilities, although there is an extension of the tax credit that helps employers provide that leave voluntarily. And finally, importantly, the relief is just pretty short term. The eviction moratorium only lasts through the end of January. The unemployment benefits are only through March, and the food assistance is only through June.
Sorry, I'm typing, making sure I catch everything that you've just said there, because there's a lot, like you had mentioned. And I think that brings us back, you've brought us back to the here and now, where those gaps are, where those short-term solutions and aid has come. And so now we get to the big question, right? Does the governor's proposed budget address these gaps, address these short-term investments with appropriate response? The governor's economic outlook was adjusted because of higher than expected revenues and a one-time windfall. Can you tell us what that means for the general fund and where we now sit financially?
Yeah, so last year's Budget Act that passed in June did take actions to cover a large expected budget shortfall, but we have seen revenues coming in higher than expected, while spending has come in somewhat lower than expected, creating this one-time windfall. And there are a few reasons for this. First, although we know that there are millions of Californians that are still struggling, high-income Californians have been doing pretty well. They've been able to keep their jobs, working from home, and they've benefited from this surging stock market. And because California has a highly progressive personal income tax system that relies heavily on high-income earners for its revenue, we have seen revenues come in better. So while that's good for the state budget, it's also a reflection of how unequal the recession and the recovery have been. And at the same time, the federal relief for workers that over the course of last year that I've been talking about has softened the blow of the recession by providing this aid to families and businesses and state and local governments. So spending on safety net programs like Medi-Cal and CalWORKs hasn't gone up by as much as expected so far. So as a result of those factors, the administration is projecting that the general fund revenues are going to be $71 billion higher over the 3-year budget window, which ends with this coming budget year. $71 billion higher than was projected last year in June. And like you said, there's going to be this one-time $15 billion windfall of resources that can be allocated in this budget cycle. But it's really important to note that this windfall is one-time. Both the administration and the Legislative Analyst's Office are projecting growing deficits in future years, with revenues coming in growing more slowly than expenditures. So it's notable that the administration isn't proposing any new policies to increase revenues on an ongoing basis. And that's why you see most of a lot of the items in the budget are one-time investments and not ongoing.
That seems so contrary. So I'm going to take part of that because there's a lot to dig in here. But it's safe to assume that the better than expected revenues, right, that came in, the governor was able to draw on those and then thus propose some of this rapid response emergency fund and emergencies funding, which I think was always part of the plan, but also this a greater one-time investments that we see in the budget, right? But how does the dichotomy, right? How does that create challenges for the state and subsequently Californians?
Well, I mean, given that we're in the midst of a pandemic and an economic crisis, it does make sense to make some one-time urgent investments to meet these immediate needs facing Californians. You know, it can mean the difference between having a place to sleep or having enough food to put on the table for your kids. So to address those urgent needs, the governor has requested that the legislature take immediate action on some of the items in the budget within the next month or so. And then he's also requested another early action package to be approved before the June budget is enacted. But in order to truly address the inequities that Adriana and Essie and Kristen have been talking about, ongoing funding will be needed, and especially in the areas of housing and homelessness and healthcare and childcare. And we know that these inequities aren't going away on their own, and it'll take additional resources to address them, and that means raising additional revenue.
Couldn't have said it better myself. All right, so let's talk about those one-time proposals, specifically the emergency relief items, many of which are part of that, what you had mentioned, these early emergency type that could come into effect as soon as next month if the legislature acts, right? And this includes that very notable one-time $600 tax refund through the Cal EITC, the Earned Income Tax Credit, that is estimated to reach like 4 million low-income households. So my question actually is to all of you, as you want to chime in, why are these supports so important for Californians now?
So I'll hop in just because I want to talk about the EITC, which is what you just mentioned. So yeah, the California Earned Income Tax Credit, it's a state refundable tax credit, and you can be eligible for it if you earn $30,000 or less. And in what the governor, the administration is branding as like the Golden State stimulus. So what is that? That's a proposal to support low-income families through this tax credit by offering these $600 of one-time tax refunds. And part of the reason why that's so important is not just because obviously these low-income families really need support right now, but a really exciting part of that is that folks who file their taxes with individual taxpayer identification numbers, often called ITINs, they usually that's typically immigrants who don't have sort of legal work authorization. And as Kayla mentioned earlier, they were cut out of the federal relief that happened earlier. And that's a significant, share of Californians. Those are our communities. So a lot of people have been left out of that relief, and it's important now that the state is stepping up to recognize them and to recognize that they need support, particularly as in prior years, they had also been locked out of the Cal EITC. So we are excited and heartened to see that they will be receiving that $600 tax refund as well.
I can jump in and talk a little bit about some proposals in the budget to mitigate food hardship that we're experiencing and seeing right now in California. So the budget proposal does make a number of one-time and ongoing investments. For example, it includes $30 million one-time general fund for food banks and other organizations who are providing food in communities. This is super important because millions in California are turning to these resources during this crisis to supplement state and federal food assistance. Or in the case of undocumented immigrants who have been locked out of many of these state and federal programs, it may be their first and only line of defense in curbing hunger in their household. So this is super important investment, and it may not be adequate actually to meet the needs in our community. In addition, the budget proposal includes $11.4 million one-time for the California Food Assistance Program emergency allotments. So this program provides state-funded food assistance to qualified immigrants who are not eligible for CalFresh, which is California's SNAP program. These emergency allotments increase households' food assistance benefits to the maximum benefit for their household size, which is great. With that said, additional funding does not reflect a 15% increase in the maximum benefit that was part of the federal COVID relief bill. So SNAP benefits were boosted by 15%, but this budget proposal is not also boosting the California Food Assistance Program benefits by 15%. And this is actually contrary to longstanding tradition where the benefit levels for these two programs are equal. And so it kind of creates a inequality when it comes to these two food assistance programs here in California. And I just would note that, like as we've already mentioned, there's a food hardship crisis right now in our state, and none of these these two items are actually not earmarked for early action. And that also is a missed opportunity when so many in California are hungry right now.
Yeah. Building on something that what you both brought up, which is this the challenges that undocumented immigrants and their families are facing right now. So I kind of want to get your take. Has the governor addressed other challenges that this community is facing?
Yeah, I mean, so when you're reading through the budget proposal, it's a bit sort of like back and forth, right? There are areas where, like as we've noted, where there is acknowledgement that the state needs to support the many people, the many Californians who are undocumented and otherwise are cut out of other avenues of receiving support, such as some of the food assistance, with the caveats that Kristen mentioned, the Cal EITC eligibility now. So on one hand, you do have those sort of acknowledgements, and the governor sort of often couches those proposals in the language of equity and promoting equity. But then there are other ways where you can see that it's not really embedded throughout the budget. It can be a bit piecemeal. So just one example is that folks noted that in the area of higher ed, for example, last budget, there was some acknowledgement that undocumented students weren't receiving federal aid. And so the higher ed institutions sort of should step up there, and especially providing emergency grants and legal aid sort of services. That wasn't really a priority in this budget. We didn't really see that. So there are areas where it's sort of give a little, take a little, give a little, take a little.
Yeah, if I can jump in, thank you, Janice and Essie, for raising this. Another major missed opportunity is the failure to expand comprehensive Medi-Cal coverage to all income-eligible seniors, regardless of immigration status. This was actually included in last year's budget, but then the governor withdrew it in May. And as a result, seniors who are undocumented will remain locked out of full-scope Medi-Cal coverage at a time when preventive health services and treatment for chronic health conditions are needed most. And I'm sure our audience is well aware of this, but I do want to point out that older adults are at a higher risk of complications from COVID-19 and even death. In fact, 8 out of 10 people in the US who have died due to the virus were age 65 or older. So continuing to prevent undocumented seniors undermines efforts to protect and promote our state's collective health. State policymakers should make sure that those who are most at risk during the pandemic have access to comprehensive health coverage.
Yeah. Yes. I think that, when we talk about it, despite these emergency responses, as you've all noted, that the state and nation needs to be doing more, where it's not enough, right? And in that context, in my mind, I can't help but think about our safety net programs. And Essie, you had brought this up a little bit earlier. Now with millions of Californians who have either lost their jobs or seen reduced wages, programs like CalWorks, right, are particularly critical resources right now. So Essie, can you go in a little bit more on that about what we're seeing happening there?
Yeah, that's a great point. So as I noted earlier, that the Californians who'd been particularly impacted economically, primarily women, primarily women of color, and that overlap low-wage earners too, and that overlaps pretty well with the sort of primary client base, I guess, of CalWorks. And last budget, actually, the administration was anticipating that because of the downturn, they would see, logically a rising caseload. They didn't actually see that last year. They're anticipating seeing it now. And some of the thinking behind why it might be a bit delayed is that folks were probably kind of trying to exhaust what state and federal aid they could access before turning to a program like CalWorks. Part of that is just, as we know, there's been long sort of running stigma and bias about being served by a program like CalWorks. Some of that often is because of the sort of sexist and racist assumptions that are baked into CalWorks. In recent years, the state has moved towards trying to step away from some of those assumptions, doing away with the maximum sort of family grant sort of limitations, but that stigma sort of remains, and it's important as the governor is proposing more funding to sort of meet this projected caseload increase, is that we really think about what are the existing barriers still for folks to receive aid. So that's sort of what we're looking at right now for CalWorks.
Yeah, and I think about these people with families, right? Especially families with young children. And Kristen, you had mentioned this also, but like, I know that you're actually working on a report right now on childcare as an economic infrastructure, right? And both of us, parents of young children, we're seeing that firsthand. What is the governor doing to make sure guardians and parents, and as again noted, women who are disproportionately impacted, what does the budget proposal do for these working families with low incomes?
Yeah, I think it's important to note that prior to the pandemic, 60% of Californians lived in a childcare desert with limited access to providers who could care for their kids while they're at work. In addition, we've lost about 3,000 childcare providers during this pandemic, and thousands more have temporarily closed, and we don't know if they're going to be able to reopen. So there has been some state and federal funding to sustain this critical childcare system, but the funding that's been allocated falls far short of the estimated level of need, which is probably why we're seeing closures and temporary and permanent. So the governor's budget does provide a small amount of funding to support childcare providers and families, 55 million one-time general fund. The details actually haven't been released yet on how that will be distributed and to whom. So wait for trailer bill language there to learn more. And then the proposal also includes cannabis fund dollars for additional 4,500 childcare vouchers. And then I would note that in the most recent federal relief package enacted in December, there were an additional $10 billion in federal childcare funds. California is expected to receive about $1 billion of that. In last year's state budget, state policymakers outlined how up to $300 million would be used if the state did in fact receive more federal relief dollars. So we have a plan for $300 million that's been laid out in state law in last year's budget agreement. However, that leaves $700 million that's that we need a plan for. And this actually hasn't been included in the budget, probably due to the late enactment of that federal relief bill. So it's also not tagged as an early action item, but the system can't wait till July 1 for relief. And so I would urge policymakers to act quickly to distribute these dollars to the field and make sure we can keep providers and families afloat.
Yeah, I think to hear sort of like this gap in planning on the state side, it seems really contrary to the governor's proposal or proposed budget in 2021 pre-pandemic, where he focused a lot on children and supporting their families. So it leaves me wondering, but also, one of the things, because he did release this master plan on learning, early learning and care, right? And one of the things I think is still in line is the focus on preschool and TK in California. The governor did make investments in TK, if I'm understanding correctly, that would make it more accessible. Is that right?
Yes, that's right. So the proposed budget would allocate about $500 million to expand access to the state's TK program. Those are one-time dollars. For those of you that don't know, Transitional Kindergarten, or TK, is a 2-year kindergarten program offered by public schools in California. Eligibility is not based on income. It's actually based on the age of the child and their birth date. So kids who are entering TK who turn 5 on or between September 2nd and December 2nd are eligible for TK. So the $500 million would be to allow even younger children born after December 2nd to be eligible for TK and to enter public TK programs. And then also provide some investments in TK and full day kinder facilities. We want to make sure, if we're going to go all in, that schools have the classrooms for these kids. And then it also includes some money for teacher training to create more inclusive classrooms. For example, addressing topics like implicit bias training for teachers, and then training for teachers to better support English language learners.
So while that is good, the governor does not include any funding in the California State Preschool program, right?
That's right. So in the governor's first budget of his term, which was the 1920 budget, he pledged to expand the California State Preschool program and had like a multi-year plan laid out. For those of you that don't know, the California State Preschool program serves families with low incomes. And in this last year's budget agreement, unused dollars from this program were rescinded to help close budget shortfalls. And this budget proposal doesn't actually reinvest in the California State Preschool program. And this actually could be antithetical to the governor's stated goals of equity, because we know that working families likely need a preschool program that offers wraparound care for a full workday, and then care during the summer months too for their young children, particularly working parents with low incomes.
So let's move into the bracket of school-age kids, right? K12 and then community colleges. There's a lot going in that space, and I know that I'm trying to be aware of time. Kristen, can you provide a very short, broad overview about what's happening there?
Right. Yes, I'll try. So, in full disclosure, I'm not the budget setter's K12 analyst. You want to get in touch with Jonathan Kaplan or Eric Saucedo if you want to learn more about K12 education in California. So we know that students, teachers, and schools have a lot of needs right now due to the COVID-19 pandemic. And there are a couple of proposals in the governor's proposal that are directly related to this crisis. Particularly, they're focused on getting millions of students back to the classroom during the pandemic. That's going to be a huge challenge, and it's going to be made really difficult by local control of school district finances. And so the governor is proposing to provide $2 billion in incentive grants that could help prod school districts along to offer in-person instruction. But there's a really rapid timeline, February and March, I believe, to actually do these things that might be hard to fulfill, and completing those requirements to receive the grants might be really difficult for many districts. In addition, the proposal would target $4.6 billion to expand learning time for English learners, foster youth and homeless youth, and then students from low-income families. So this proposal does a good job in recognizing the equity issues exacerbated by the pandemic. I would note that there was a dramatic swing in required spending for K12 schools and community colleges since last year's budget agreement. And this highlights the degree to which state budget revenues can really affect K through 14 education funding. And so the governor proposes to create additional tax credits for small businesses that might be warranted right now in the midst of this crisis. But it's also really important to remember that K-14 education loses 38 cents for each dollar spent on these tax breaks. And so there's kind of a give and take there to consider. One way to keep school spending whole would be to increase tax rates or reduce tax breaks for large corporations whose profits have soared during the pandemic, and many of which are actually paying far less of their profits than a generation ago.
So where are we putting our values and priorities, right? I think about Scott Graves, our director of research, always says that our budget is a reflection of our values and priorities. So, we're going to have to grapple with that, with each other about that. I want to turn things over now, moving even higher in the age bracket, to Essie, and talking about the higher education space and what we're seeing in the California community colleges, CSUs and UCs. Can you give us a little bit of an overview on that as well?
I'll be pretty brief. Overall, sort of, and I won't go into the numbers and all, but just overall, what we're seeing there is kind of just a reflection of the awareness that students in higher ed, are not, in any way insulated from what's going on. They're struggling, their families are struggling, and a worry about how to support students and how to retain them. So there's funding towards ongoing funding, for example, at the CSU, to support students' basic needs with housing and food. Again, students were struggling. A lot of students were struggling with these basic needs before the pandemic happened. So it's important to continue to help keep them afloat right now. There's also funding towards sort of one-time emergency, just financial grants to low-income students who need it, and proposals, or propose funding for that, and proposals also to acknowledge that while students are sort of not on campus or studying from home, that not everyone has the same access to the internet. Not everyone is as equally connected. So trying to close those gaps in through digital connectivity. They're calling it digital equity, and then also money to support mental health, access to mental health resources as well. So generally, the mood there is how can they support the students that they have and try to keep them whole and keep them enrolled, so that these struggles, these barriers don't keep people from succeeding.
Yeah. It seems that, this might go without saying, but students will continue to be in flux as we see whether or not we're returning to schools and if it's safe to do so. And Kristen, you had mentioned earlier, the governor has put in this proposal in here that is incentivizing a safe return into in-person instruction. But also, as you noted, it doesn't seem very realistic, right? Like the timeline. And I think we saw yesterday that LA Unified is suing the state over the reopening proposal, especially amid the pandemic. And I think that at least how I see is the key part here about being able to return safely is the COVID-19 vaccine, right? And the distribution of that. So Kayla, is the state making investments for that distribution? Are we getting to the people that we would need to follow through with this plan?
Well, so I would note that the budget does include $300 million for as an initial estimate for vaccine distribution efforts, and the administration also expects to receive about $350 million from the federal relief package for vaccine distribution. But I think Adriana can speak more about what's going on with that.
Oh, yeah, you pretty much covered it. There is sort of a lack of clarity around the federal funding. If the state were to receive additional $350 million from the federal government, would that supplement or replace the $300 million general fund that you mentioned that's proposed in the budget? And I believe that's something that the legislature will have to decide in future budget deliberations. But in any case, this funding is going to much needed COVID-19 related support on vaccine distribution, including a public awareness campaign. As I'm sure our audience knows, there's some skepticism around the new COVID-19 vaccine. And I think that's generally true for all groups, but notably among communities of color who have been mistreated in healthcare settings and in research and have some very legitimate concerns around the vaccine. So this presents a big challenge in overcoming the pandemic. The administration has created a vaccine task force, and one of the working groups, the Community Vaccine Advisory Committee, is providing input to ensure equitable vaccine implementation.
I think that also is a call for not just this emergency relief funding for the distribution, but why ongoing investment is so important because of this historical place that put communities of color and people in a vulnerable spot to begin with, right? What are ways that the budget addresses or doesn't address these health inequities that did exist pre-pandemic?
Yeah, that's a big question. There are two ways to answer that question. I'll start with how the budget does address health inequity. And I won't go through the full list because that would take way too long. And I'm also trying to be mindful of time. But one thing that I want to mention is that the administration revived an ambitious Medi-Cal reform effort called CalAIM, which stands for California Advancing and Innovating Medi-Cal. This was launched late 2019, but was then proposed due to the pandemic. The main goal of this initiative is to better support millions of Californians enrolled in Medi-Cal, particularly those experiencing homelessness, children with complex medical conditions, children and youth in foster care, Californians involved with the justice system, and older adults who often have to navigate multiple complex delivery systems to receive health-related and social services. So CalAIM aims to coordinate health and social services in a patient-centered manner, improve quality outcomes, reduce complexity across delivery systems, and implement value-based initiatives and payment reform. The administration assumes the implementation of CalAIM would begin on January 1st, 2022, and that $1.1 billion, that's 531 million general fund, would be available during the initial fiscal year. And also one thing to mention, given the improved revenue outlook, the proposed budget delays the potential suspension of state funding for a wide array of programs and services that boost access to care and generally support Californians' health and well-being, including certain Medi-Cal provider payments, the delayed suspension of Medi-Cal postpartum extended eligibility, which essentially extends the duration of Medi-Cal eligibility for postpartum care for an individual who is diagnosed with a maternal mental health condition. There's a lot on the behavioral health front in general, some really exciting things on the telehealth front too. But to answer the second part of your question, the proposed budget does not include funding to expand comprehensive Medi-Cal coverage to all income eligible seniors, regardless of immigration status. I think that needs to be restated. And two other things, while the budget does include funding to continue COVID-19 response measures such as laboratory capacity and testing, specifically $820 million general fund, there are no new investments for local public health departments, and public health officials across the state have expressed that more support is needed to adequately bolster public health infrastructure to better respond to health threats. And one last thing to mention is that the governor failed to boost state financial assistance for older adults and people with disabilities, even though the recently released Master Plan for Aging recognizes the inadequacy of the current assistance.
I want to emphasize that, there's a lot in this health space, and while we didn't get to cover it all, go to our report at calbudgetcenter.org, and you can see all the details and numbers and everything in there as well, and shoot us emails and questions if you have them. One of the things that has been touched throughout this program actually has been one of the most significant ways that we can mitigate the spread of the COVID-19 virus, which is being able to social distance at home. As we all know, Californians are in a difficult place economically and are endangered of losing their homes. But affordable housing has been an issue way before this pandemic, right? So Kayla and Essie, can you tell us a little bit more about how the nation and California is responding, right? Both immediately and long-term.
So I'll just quickly note that the federal aid package, as I mentioned earlier, does include some funds for rental assistance. The administration expects that about $2.6 billion of that will come to California, and it needs to go to the states and local governments within 30 days, but we don't know at this point how the state and local governments will distribute it and when.
So to that point, the governor just proposed then extending the eviction moratorium because we don't know when the money's actually coming in, and the moratorium currently is scheduled to expire at the end of the month. So definitely need to push that out to avoid any harm to folks. But then in terms of the funding, both from the affordable housing and then just generally the homelessness space, there is funding towards housing development through tax credits and such. But then on the homelessness front, there is money, sort of, for example, like $750 million one time to support, continue to support Project Home Key, looking for intermediate and permanent housing for people experiencing homelessness, particularly inspired by the pandemic and the increased need to keep people housed right now. And more one-time funding for other acquisition and maintenance of property and for behavioral health needs as well. But it's important to note that a lot of this, or at least in the homelessness front, is again one-time funding. And I think the LAO, the Legislative Analyst Office, in their response to the governor's proposal, they noted, as they have before, that while these one-time sort of measures, they're good, it's important to have funding to keep people housed, they don't really add up to a real sort of ongoing, comprehensive plan on what the state is going to do about the fact that so many of its members live without stable housing. So it's sort of a on the one hand, good that there's funding for this. On the other hand, we really need to be looking beyond one-time sort of quick fixes.
Yeah, so we have 5 minutes left, and we covered a lot today. And as we come to a closing, I want to make sure that we have time for Q&A. But I want to bring this back to the core of discussion, and it has been drilled into my head. You can't have a conversation about all these expenditures and spending without talking about the other side of the budget, which is revenues. And we know that California has substantial but concentrated wealth, and that means our state can afford to make those ongoing investments that I think all of us have called out today that are needed for a more equitable recovery. Kayla, what is important about this moment, and how should state leaders approach this budget?
Well, that's a great question. I think what's important about this moment is that, as we've all been talking about today, it's become crystal clear that the inequalities that we're seeing in the impacts of the pandemic and the recession are just symptoms of these long-standing structural inequities in the state. And we're going to need significant investments to not just get back to where we were before the crisis, but to get to where we need to be. So that really is going to require state policymakers to put forth a budget plan that does raise additional revenues and does so by making the tax system more equitable. And that's really going to put the state in a position to not just meet the immediate needs that are clearly important, but to ensure the ongoing health and economic security of all Californians, especially those that have been hit hardest by the pandemic and that were really struggling even before this crisis.
Yeah. So in summary, policymakers should take bolder action to ensure public health and economic needs of Californians so that so the effects of this pandemic aren't long lasting, but also that we can do more, right? We can address the inequity issues that existed well before the pandemic. And I think that's a good note to end. And we'll return things to Q&A, which, as if I'm looking at this correctly, we're able to answer a lot of these questions within the piece. So I wanted to shout out one more that's more specific, and it's Kristen, and it says, you talked about childcare and funding in the budget for providers, but can you share more about who providers are and why providers and their families are vulnerable to shutdowns?
Sure. So childcare providers and caregivers are primarily women and disproportionately women of color. And as a result, these jobs are undervalued and underpaid. And during this crisis, childcare providers have been dealing with decreased enrollment and increased costs due to things like buying PPE and additional cleaning, for example. And providers were already operating on very thin margins prior to the pandemic because it's expensive to provide care for children. And families can't actually afford the true cost of care. And therefore, we need government intervention is the short story to that, to help families and providers in this market, essentially. But long story short, it's been a huge hit to childcare providers who are already struggling to make ends meet and keep their doors open prior to the pandemic.
Thank you. I'm also going to try to wrap things up because I hear things going on outside my window. But I want to close, actually, because I think we've answered most of the questions that came in. And if we didn't, please reach out to us, contact@calbudgetcenter.org if you have anything else. I'm going to have a really quick answer response here. The question that we get asked the most is a lot of what is in the policy and investment. What should state leaders prioritize and focus on in the next few months? What would be your answer to that question? Anybody can go first.
Childcare. We can't have an economic recovery if we don't have a childcare system so children are safe while parents are at work.
I would add healthcare coverage expansion for all income-eligible adults who are undocumented. While immigrants are a key part of our state's workforce, our communities pay taxes, make significant contributions to our society and economy, they generally lack access to healthcare. So we need to make sure that everybody has the opportunity to be healthy and thrive.
I would say this isn't really like an issue area, but like focus on the well-being. How are women of color doing? How are immigrant workers doing? As we said again, they're the ones taking the hardest hit, and we can't define success or healing or recovery or whatever you want to call it if they're not doing well.
Everything that everyone else said, and also just ensuring that all Californians have access to economic security and the ability to share in the state's prosperity once we get there again, and just being able to weather the crisis.
Well, we are exactly at 11 o'clock. I want to thank all of you for joining us today. Reminder, you can find this information and a ton more on our website, calbudgetcenter.org, including the first look report that our amazing team of analysts put together that was released on Monday. Thank you again to the amazing panelists that I had with me, Essie, Kayla, Adriana, Kristen. We could talk the rest of the day, but I also know that there's a Senate budget hearing this morning, so we're going to get to that as well. And a special shout out to the Budget Center's Advancement and Communications team, Lillian DeWong, Mauricio Torres, Marcelo Salvador, and Sarah Jimenez for all the help to make this possible. And thank you all again for joining. We truly hope that you leave us today with a lot of information, action steps in mind, and feeling a little bit more empowered.